Hello there, and welcome to part 2 on OCD on Psychology Demystified. Fear of contamination, either by disease or infection or an unpleasant substance. And I don't mean that if you carry around sanitizer and give it to people before they shake your hand, which of course everyone is kind of doing now and not shaking hands, but if you were that kind of person who had sanitizer with you and needed to make sure things were clean and didn't like shaking hands, that does not necessarily mean that you have OCD. Someone with OCD will take it top notch, which means that they will have the fear that you had of germs, but theirs is so severe that they don't actually want to go near people. So it's not as simple as, I'll shake your hand, but I'll use sanitizer. It is, I cannot shake your hand. It doesn't matter if you bathe in sanitizer, I cannot do it. Now you might think, especially in this time of COVID, that you're washing your hands repeatedly and that means that maybe you have OCD. No, you don't. Someone with OCD and severe OCD will wash their hands so much and so often that sometimes they wash their hands raw, as in raw. When I say raw, I mean wash them until sometimes they bleed. That is how severe OCD can be. So there is a difference between you washing your hands every 10 minutes and someone with OCD washing their hands to neutralize a behavior, to neutralize a thought. A need for symmetry and orderliness, which means that someone with OCD will need to have their jars labeled a certain way and arranged and facing a certain direction. Someone who does not have OCD may want them arranged a certain way because they like things looking orderly. However, if you turn that thing around, if someone does not have OCD, they can just turn it back and make sure that it's aligned, but they won't flip out. If you do that, the turning around of something with someone who has OCD, you have truly messed with their life, caused them distress, caused them angst, and just messed with their day. So even though you might think it might be fun to try it out, don't. Now, someone with OCD is not unaware that they have it. They're very aware that they have it. They're over-aware that they have it, and they're embarrassed about it. So it's not something that you're going to tell them that they don't know. They already know that it's irrational, but they're still going to do the behavior as a compulsion just in case. I just have to make sure that my door is locked one more time, even if it's the 54th time. I just have to make sure that my hands are washed one more time, even if they're bleeding. I just have to make sure that my child is breathing one more time, even if I just checked. It is paralyzing. Another thing about people with OCD that you might not know is that sometimes they repeat something they've said because they don't think they've said it correctly. So that's also, it's a repetitive thing. Repetitive behaviors, repetitive compulsive. The word repetitive just keeps coming in. Someone with OCD will avoid a situation or a place, especially if it triggers. So they tend to avoid a lot of things and not go out as much because then it's just easier to stay home where I know everything is sanitized and safe and I don't go and meet friends because of my OCD, and that's just how they function. You also have to keep in mind that not all compulsive behaviors will be obvious to everyone. A lot of us look for those outside signs. Someone's cleaning excessively, oh, they have OCD. Someone likes to arrange their desk a certain way, oh, they have OCD, and you like to mess with them. But not everything is as obvious. There's some people who have compulsive behaviors where they count on their fingers and you don't notice. Some people have an obsessive tapping of their foot. There are interesting things that you may see in someone and not know that those are actually compulsive behaviors. And that person is battling so hard with OCD. People who have OCD are often reluctant to seek help because they're embarrassed about who they are and what they're doing. But it's important for someone with OCD to know that they shouldn't be embarrassed because it's like any other health condition. If you have a cold, you go and see someone. If you have a rash, you go and see someone. So if you have OCD, you should go and see someone. One of the main treatments and where you start off is psychological therapy. And one thing that seems to work quite well for OCD, and of course, because people are not templates, it's not going to work magically for everyone. However, the thing that works a lot for people who do have OCD is CBT, which is cognitive behavioral therapy. Keep in mind that although CBT works quite quickly, sometimes some people don't see significant changes. And until someone actually mentions, oh, you don't do this as much, then you might not notice. But CBT does work, and quick is about a couple of months. So if you're expecting to have 3 months and I'm done and I'm all good to go, that's unrealistic. If therapy alone, CBT, is not working, then you will be put on antidepressants that are called SSRIs. Yes, I know lots of acronyms. These are selective serotonin reuptake inhibitors. And what they do is they help to alter the balance of chemicals in your brain. SSRIs, you might not notice their effect immediately. It's just like many other medications that don't kick in immediately. They just take some time. But both of them are known to work quite well. And some people need both and some only need one. Because humans are not cut and paste, there may be some people who don't respond to either of them. When that happens, then you are referred to a specialist who does deal with OCD. And then they can try and figure out whether to up your dosage or to figure out what kind of therapy would work better for you. But it's always better to start with the therapy, then if necessary, the SSRIs. Then if those two don't work, then of course see a specialist who then will help you figure out what next. Another way to treat OCD is to seek support from a group that does also have members who have OCD. One of them I can think of is Health Unlocked OCD Forum, which is UK based, but it does work to know that there are people out there who are like you and that there's nothing wrong with you. You just think differently and you're wired differently, which is the beauty of humanity. So who do you go to first if you think you have OCD? Your GP, your general practitioner. Your GP is trained in noticing the symptoms and the signs of OCD. So speak to them openly and honestly, because that's the only way you can get the help you need. Speak to them openly and honestly, and then they will refer you to either a psychiatrist or a psychologist or both, because a lot of times we work together. We work as a team where the psychiatrist prescribes the SSRI. I, as a psychologist, will provide the CBT. I know you now know what those acronyms mean. And as a team, we all work together, all three of us, to figure out how to help you deal with OCD and the angst that comes with it. But it is treatable. Thank you so much for watching. Have a wonderful day if you're watching this in the day. Have a wonderful evening if you're watching this in the evening. Please remember to stay safe at all times, and hugs and kindness always.